Our second lecture for week 7 is over the eyes, kidneys, and thyroid dysfunction. These three conditions have less likely a chance to causing emergencies in the dental office, but there are some things about them that are significant to note. In the middle of the back page of the medical history form is where you're going to find these conditions. So they are outlined there in orange for you to see. Glaucoma is a condition with the eyes where the pressure within the eye itself is increased. And glaucoma is actually one of the most common causes of blindness. There's two different kinds of glaucoma, one which is called open angle glaucoma and narrow angle glaucoma. In open angle, there's less of a concern. It's a very gradual deterioration of the vision, and as it progresses, peripheral vision is lost as well. In narrow angle glaucoma, it's more severe. It's a more acute issue. It's where there is sudden severe pain and abruptly there is vision blurring. So it's pretty rare, and it must be treated very quickly to prevent blindness from occurring. One of the potential emergencies that could occur in someone with narrow angle glaucoma is when we prescribe drugs that are anticholinergics. A common one is atropine that is used to reduce salivary flow. The only time I've ever heard of anyone using it in the dental office is for when patients are getting whitening. They can salivate a lot, so to help that, they'll prescribe atropine. And what atropine does as an anticholinergic can increase the inocular eye pressure. So we want to make sure that we're not prescribing this to patients if they have narrow angle glaucoma, because that can cause a really traumatic issue. Moving on to kidney conditions. The one kidney condition we're going to talk about is end-stage renal disease, abbreviated is ESRD. So our kidneys have a pretty main function to eliminate waste. So they quote-unquote clean the blood. End-stage renal disease is commonly caused by diabetes, hypertension, and chronic glomerulonephritis, which is a slow, damaging condition of the kidneys. When the kidneys fail, they can cause fluid overload, hypertension, and cardiac complications such as heart attack and stroke. And actually, 50% of patients that have end-stage renal disease die of some kind of cardiovascular event. Patients that have end-stage renal disease often have to go through dialysis because since their kidneys aren't functioning properly to clean the blood, they need to do dialysis, which is a process that helps detoxify the blood when the kidneys aren't working. So it eliminates the toxic waste from the body for the kidney because the kidney's not doing it. So hemodialysis is where blood is pumped from the body. They usually put something that's called a stent in the arm, and that is hooked to the arteries, and they pump the blood from that to an outside filter. The blood is purified then outside the body and returned. Once it's purified, it's returned to the blood through that stent. Hemodialysis is performed in a dialysis center, so you've probably seen those as you drive around. You see dialysis centers around, and it takes a long time. It takes about 4 hours, and people usually have to do that 3 times a week. Some treatment modifications that we may need to make if someone does have end-stage renal disease. If they're receiving dialysis, we want to appoint them on the day that follows their dialysis. So the day following a dialysis treatment is when they should be coming in for a prophylaxis or any kind of dental treatment. We also want to make sure that we're monitoring their blood pressure because they could potentially have higher blood pressure due to their renal disease. So we want to take it on the arm that they're not getting the dialysis from. They usually have a permanent stent in place, so we want to be taking it from the other arm so that we don't collapse the artery that they're drawing it from. And we also want to consider getting a physician's consult if they need extensive treatment. So the more extensive work that we need to provide on these patients, we want to make sure that they are healthy enough to get that treatment. Patients that have got a kidney transplant, we definitely are going to make some modifications and considerations for our treatment. So during the 6 months after they've received the kidney transplant, they're going to be taking anti-rejection medications. So patients need to take this medication so that their body can adjust to having a new, different organ, and they're not going to reject it. A lot of these anti-rejection drugs cause immunosuppression. A very common one is called cyclosporin. And when patients have immunosuppression, their wound healing can be depressed, so we want to make sure that that's something that we are aware of. And also, cyclosporin in particular can cause some side effects. We can have increased bleeding, we can have more ulcerations, something called gingival hyperplasia, which means overgrowth of the gingiva. So we can see that in patients that are taking such drugs such as cyclosporin, where their gingiva is extremely overgrown. It might look puffy or bulbous, and it's not necessarily induced by plaque, it's induced by the drug. And they can have a reduction in salivation. So for kidney transplant patients, when they are taking these heavy doses of their anti-rejection medications, it is commonly known to not provide any kind of routine or elective dental care during those first 6 months. We would only be treating these patients for emergency concerns. The thyroid gland has the major function of producing and secreting hormones in our body. The 3 major hormones that it produces and secretes are T3, T4, and calcitonin. If there is an insufficiency in thyroid gland function in childhood, there could be cretinism, which is a condition that is characterized by physical and mental delays. This can also include tooth development. So the development of the tooth itself is poor, and it also can result in delayed eruption dates. They might not follow the same pattern as our normal eruption dates that we are learning. Insufficiency in adulthood can lead to myxedema, which is weakness, also fatigue, weight gain, and cold intolerance. The etiology of thyroid dysfunction, or the cause of thyroid dysfunction, it can be unknown or idiopathic. It could also be an autoimmune condition. It can be due to genetics or radiation. There's a lot of different reasons that thyroid dysfunction can occur. So I really just want you to know that there's a lot of different causes. There's not just one cause for thyroid dysfunction. So this concludes our lecture on eyes, kidneys, and thyroid. There's not a lot of emergency concerns with these conditions, but there are some treatment recommendations and considerations that we will be making for these conditions.